Good afternoon, everyone. Thank you for joining. My name is Claire Paprocki, and I am the Public Information Officer for Brown County Public Health. I hope everyone had a good weekend. Today, we have a couple guest speakers with us. We have Brown County Executive Troy Streckenbach, who will have some comments about businesses reopening and areas of flooding. We also have Randy Van Straten, who's the President of Business and Community Health with Bellin. And he's going to talk about the health and safety advice and guidance that they are providing to local businesses that they work with. And then lastly, we'll have Lori Mackey, who is the Brown County Emergency Management Director. He's going to join us to talk about flooding in Brown County. First, though, I will give everyone an update on numbers. We have 2,088 confirmed cases in Brown County. Oneida Nation is reporting out 26. That brings the total to 2,114. We currently have 30 individuals who are hospitalized. We have 364 individuals who are out of isolation. On Saturday, the Resch Center was able to test 267 individuals. Casa Alba was able to test 295 individuals, for a total of 562 over the weekend. Countywide, since we began community testing at the Resch Center and Casa Alba, we have been able to test 9,152 individuals at both of those sites. Unfortunately, I do have to report 5 more deaths from this weekend. The first one was a male, 92 years old, from the zip code 54162. The next one was an 89-year-old male from the zip code 54162. The third one was a 63-year-old male from the zip code 54301. There was a 66-year-old female from the zip code 54301 and a 60-year-old male from the zip code 54301. I think everyone has probably seen this, but Casa Alba, Melanie, that testing site has been closed just for today due to inclement weather. Those that had an appointment scheduled today can either call 211 to reschedule their appointment. 211's hours of operation are 8 to 5 p.m. Central Standard Time, Monday through Friday, or they can go to www.stayhealthybc.com to reschedule their appointment anytime. We anticipate that Casa Alba testing site will reopen tomorrow morning as long as the weather allows. Now I will turn it over to County Executive Streckenbach.
So I just want to make sure everybody can hear me, because on my end there's some glitching going on, or the internet is not 100%. So can everybody hear me? Randy, can you hear me? Okay, good. Thank you, Claire, for the update. I think in terms of the course of the last couple days, when on Friday when we received our numbers, and this Monday when we're receiving the numbers, an increase of roughly 70 positive, a massive amount of testing taking place. We are certainly doing exactly what we were hoping for, was to try to see how prevalent it is in Brown County. That allows us to continue to work on our plans to reopen. It is always discouraging and sad to see additional deaths in Brown County that were tied to the COVID virus. And hopefully we can continue to implement the appropriate guidance and reference, both from the CDC and the WDC, what they have out there for businesses to be able to operate. We're going to briefly talk about that with our guest, Randy Van Straten, the VP of Business and Community Health for Bellin. I just want to kind of briefly talk about a few things prior to getting into that. So number one, as you saw last week, Brown County made a decision based on legal advice from our Corp Counsel to rescind our safer at home order for purposes of remaining. How does one county do it when you have surrounding counties not? How do you continue to operate from a system where you're really hoping that you would have a statewide guidance. And without that statewide guidance, it really put Brown County in an awkward, in an unfortunate position. The same thing is we will continue from the county's perspective to reiterate the importance for the state of Wisconsin to really bring forth, and ultimately this is what we're hoping, is that they would implement the CDC and WDC guidelines. From what we see, that those guidelines, are what are appropriate. I know that when working with our area industries through our public health, a lot of the documentation that we have been putting together resembles what the CDC and WCD have put together. We also understand that at times, such as the CDC guidelines, they were just recently updated. And in order for the state to operate more in sync, we think that it's critically vital for the state to adopt, if they're looking at additional standards for the state to operate within. This would be a perfect opportunity for the state to to adopt and then recommend, or to require for states, for counties to operate with. And that would then allow our public health to have better guidance. It'll allow a more statewide perspective in terms of managing the current crisis. And then it gives, which quite frankly, this is the number one thing that we continue to hear, is what is the certainty in terms of the rules and guidance that's going to be provided. If you have one county providing one system and you have another county providing a different guidance, you have uncertainty. What we need is certainty, and we're hoping that the state can provide that at some point in time in the future. Right now, Brown County's main objective and the main message to the businesses in Brown County is to really go on to the CDC, WEDC websites, contact the local chamber in terms of getting your guidance and as to how to open safely, both for your customers and for your employees. The guidance within those documents is very valid, it's very strong, and it's something that you should be taken into account. And so to talk more about how the healthcare systems who work with their individual clients, we are proud to have on with us today Randy Van Straten, who works with he's the VP of Business and Community Health, and works with the private businesses to help develop their own plans. And to learn more about what they're talking about and what they're providing for guidance, we have Randy with us today. Randy?
Hi, Troy. Can you hear me okay?
Can.
All right, great. Well, yeah, we are calling this coexisting with COVID, and really to be safe at work. And I got to tell you, I've been really proud of the Bellin team lately. We've had the opportunity to work with multiple employers in the area. We've been involved with assessing work environments. We've been out testing in the workplace. I got to tell you, we've worked out of tents, trailers, parking lots. We've been involved with employee entrance screenings, temperature checks, screening questionnaires, return to work coordination. We've been out on site as early as 10 a.m. At 2 a.m. in the morning, working with different employers. So we're out there, and what we've done is not only are we out there, but we're really listening and understanding what the needs are of the employers right now. And it really has developed some themes out there, and 6 of them really come to mind. And that is, number one, the importance of screening at the place of the employer site with the temperature and the questionnaires. And then, of course, if someone screens positive, having a plan in place of what do you do. That's number one. Number two, lots of questions around facial coverings and maskings. And then, of course, the policies that go with that. So we've been helping multiple employers develop those policies and help create education around that. Number three, really consistent messaging on what you're working with, what your messaging is for your customers as well as your employees, and that education. And then number 4, the social distancing piece. How does that apply at work? What are the spatial barriers that are created? So we're seeing a lot of innovation with that lately. Number 5, it's checking your policies, making sure your policies around your pay practices and so on are in line with helping make sure the workplace is safe. And then number 6 is your cleaning and hygiene too, of turning over workspaces and restrooms and the whole touchless doors, touchless sinks and things like that. So those are some of the things that we're seeing. So what's our response? Well, we've developed, in working with the CDC and OSHA guidelines, we've developed a survey and assessment that employers can take. So we've been out doing those virtually, taking tours of companies and offering recommendations. And then we also have been giving employers an employee confidence rating tool. It's a SurveyMonkey that employers can use to assess the confidence of their employees with having a safe workplace. And then in addition to that, we've created on Bellin.org in our For Business section, we've created a whole host of sample policies, return to work, in different examples so employers don't have to start from scratch with a lot of these things, as well as then the links, like you mentioned, Troy, to the CDC and the other websites are all linked in there for just a quick resource. So that's what we've been up to in helping guide this coexistence with COVID and helping employers be safe at work. Back to you, Troy.
Great, thank you, Randy. I appreciate the update. And those are going to be very important conversations that individual businesses have. From the Brown County's perspective, there's a number of things that businesses can be doing to make sure that they're opening safely. One, they should be speaking with their state association and federal, national associations if they have them, to get best practices and guidelines that perhaps those organizations are doing in conjunction with their state and federal authorities. Secondly, the next best is really to look at what the state is putting out there. Again, I would say this, I know a number of business owners who have businesses in multiple different counties. And the one thing that is difficult for them is to operate, hey, in one county got to be operating this way, and this county got to be operating this way. What we need is really truly that consistent guidance that's going to be provided. So from that perspective, Brown County has relied heavily on and encouraging businesses to reflect or to go to the WEDC, CDC websites, contact your local chamber like the Greater Green Bay Chamber of Commerce, which has not only a helpline to help you best understand how PPP, some of those things that Randy was bringing up in terms of some of that not legal advice or just the policy questions. The chamber has assembled a number of experts to help small businesses with those type of questions. And then lastly, really, from decisions about whether you should or shouldn't open up, ultimately that should be up to the business. They should be making a determination of whether or not they're prepared. Have they put the safeguards in? These are all things that they should be working on in order to properly, safely open for the business. And I think individually as community members, I think it's, there's the responsibility of us as individuals to make sure that when we do go in to establishments that they look to be instituting the type of safeguards that we want to make sure that we're protecting our overall community. That said, finally, I want to talk about, recently Senator Coles and Congressman Gallagher had requested to the state of Wisconsin some assistance to Brown County. As I noted last week, Dane County alone received $95 million directly from the CARES Act, collectively between Milwaukee and Dane County, they've received $260 million that they are able to use for our helping businesses restart, cover some of those expenses. It certainly helps with covering the expenses of addressing the pandemic in their communities. And Brown County hasn't received, any dollars in terms of that. Right now, we have the responsibility of taxing our local jurisdiction 25%, cover those expenses. And so we're hoping that that the state will recognize how Brown County is being impacted with the COVID and providing some financial resources to cover that 25% that we're required to. We now have Lori Mackey, who's joined us to really talk about, as we saw last night, the storms have rolled in. It's coming from that northeast direction, which we know with the high water levels in the Great Lakes that we are going to anticipate flooding in the area. I can say that I'm really proud that our Public Works, under the leadership of Paul Fontecchio, had purchased that sandbagging machine, which made it available to the municipalities in Brown County, along with municipalities throughout Northeast Wisconsin. I know Oconto County had purchased some of the bags from Brown County back in the earlier part of this year. But we are seeing photos that are emerging on the news sites of flooding taking place, Suamico area, Green Bay area. And to talk a little bit more about that, we are being joined with our Emergency Management Director, Lori Mackey. Lori?
Thank you, Troy, and good morning, everybody. Thanks for joining us this morning. So starting last year in December, we started having flood response meetings, which was a variety of participants from public safety agencies, municipal leaders, and others, which culminated in a press conference, I believe in January, where we unveiled our website, floodinginbc.com, that was created as a flood resource for the citizens of Brown County. Throughout those meetings, we reestablished the old PIO group, the Public Information Officer group, which was almost non-existent at the time. Ironically, that has turned into what Claire and Nathaniel are currently pioneering and utilizing with these media briefings. So kudos to you guys for taking what we built and running with it. It's appreciated. We created the floodinginbc.com website, like I mentioned, through partnerships with a variety of county agencies. We try to keep that updated with county road closures. It also has flood information for both before and after flood events. In addition to that, we created a flood preparedness mailer, is what we called it, and that was mailed to everybody that lives in a floodplain in the county. And that looks like this. It's got our website, mentions going to sign up for Code Red. I will email that to Nathaniel and he can share that with you. We also have a Spanish version in addition to the English version. You can also find that on our Facebook page. Myself and my coordinator try to stay very active on social media when we have information to share. After that group continued to meet, the idea behind that group, of course, was getting a coordinated countywide effort. Really, we're all in this together. The same with COVID and flooding. We're all in this together. So developing and strengthening those partnerships with agencies from around the county. After the group culminated in the press conference and we felt ready for flood response, as Troy mentioned, Paul Fontecchio and Brown County Public Works had purchased a sandbag machine and thousands of sandbags, especially after the spring flooding we had last year. So the idea was to establish some type of procedure with DPW, which involved when a citizen wants sandbags, who they can call, and the chain of command, how it works its way up. So we established that and started giving presentations on flood preparedness and the procedure of who they needed to contact to get in touch with potentially acquiring sandbags. staff from Brown County and Green Bay participated in a sandbag demonstration that was given by the U.S. Army Corps of Engineers. We developed a partnership with them, the DNR, and the Wisconsin Sea Grant Institute. The Army Corps came up and gave us a demonstration on sandbags and how to properly sandbag, and the true requirement of how many sandbags it actually takes is a lot more than people think. On a day-to-day basis, obviously it started raining yesterday. We have record high water levels, so it's something we are consistently monitoring, especially when we get a forecast like we had starting this weekend. We're always encouraging citizens of Brown County to sign up for Code Red. Code Red is our emergency notification system. We actually have mapped out areas around the Fox, East, and the Bay that we send flood preparedness messages out to in advance of potential incidents like this weekend. And then we utilize those same groups to send out any warnings that we may need to send out should it be happening. The current problem areas, I've talked to many of you in the past. It's nice to see a couple faces, but it's the same story, different day. It's the same problem areas along the Fox River, along the East River, and along the Bay. The three major factors, of course, right now are wind, rain, and water levels. The water levels are record high. The wind was out of the north, and it's been raining. Fortunately, it's been sprinkling, and fortunately, the wind has been predominantly out of the east, which has benefited us. We are approaching flood stage, and it really is a waiting game at this point to see what happens. Through those partnerships we've built with public safety agencies around the county, our major role in emergency management is to support local municipalities during emergencies. So as mentioned before, we really work on constantly improving our own response and our partnership with these agencies. Green Bay Fire, Green Bay Police, Brown County Sheriff's Office, and other agencies around the county, specifically those in the problem areas, we stay in constant communication. They feed us updates. They really are our eyes in the field, if you will. If they see issues, they let us know, and then we function as support. Should there be an emergency, we're always there for those municipalities. If they become overwhelmed, they can ask us to activate, is what we call it, activating our Emergency Operations Center, or EOC. And we activate that to assist local agencies and municipalities and helping them manage those emergencies from a big picture standpoint. Currently, we're working on finding a balance between COVID and flooding. We actually had 2 simultaneous EOC activations in April and could potentially see one in the next day or 2, depending how the rain continues to fall. The bottom line is that we aren't in control. Mother Nature is, and we can only predict to a certain extent of what's going to happen. So our best option is consistently be prepared, remind friends, families, coworkers, everybody in Brown County to be prepared and do as much as possible in anticipation of weather events such as this. I appreciate your time. Thank you for listening, and I'm going to send it back to Troy Streckenbach.
Thank you, Lori, for that update and just kind of explanation of how we have been planning and preparing for this, especially from the wake of the flooding that we had last year. I would hope that, in the media, you've done a great job in helping us get the word out back when we created the Flooding BC website and the preparations. I think you've done an awesome job in helping us communicate to the public about where residents may be able to purchase or to pick up sandbags. City of Green Bay has done, has been extremely helpful with us in terms of being that they're one of the hardest hit from the east side and from the Fox River, perspective, helping their residents to work on this. So overall, we look outside and we see the flooding that's taken place. Hopefully, residents have had the best chances to prepare for this and in the best position for safety. So from that standpoint, thank you, Lori, working with the community partners to prepare the public for the flooding that we're seeing today. And that's the interesting thing, you know, while Brown County is going through the response for the pandemic with the COVID issue, we also now have another aspect where, you know, with the flooding that's taken place, and hopefully this will subside here in the next few days and allow us to continue to monitor and work on the overall response for the COVID. I guess I'll end with this. Number one, it's critically important for the public to continue to adhere to the directions and the safety measures for yourselves and your loved ones by making sure you're wearing a mask in public, keeping that social distancing, you know, keep that 6 feet apart. And when you're going into a business, you know, make sure that they're implementing the appropriate procedures to protect not only you, but also their employees. And hopefully over time, the state of Wisconsin, in the next few weeks, the state can work out an agreement that can ultimately be the guidelines that every county in the state of Wisconsin can adopt and operate within, so that we have certainty when traveling from one county to the next, because we all know that we're a very transient population. We enjoy our ability to freely move about. And the best thing for us is to understand and have certainty in that context. And so from that standpoint, Claire, we'll turn it back over to you for questions and answers.
Thank you, County Executive Streckenbach. Just a friendly reminder, our briefings for this week will be held on Monday, Wednesday, and Friday at 12 p.m. On Tuesday and Thursday, when we do not have a briefing, we will send you the numbers by, around 12 each day. And as always, if you could please announce your name and the outlet you are reporting from, and then who your question is directed towards. Again, we have myself, County Executive Troy, Lori Mackey, and Randy on the line with us today.
This is Haley with the Press Gazette. My question is for Troy. So I just want to clarify, so the county has not received any funding through the CARES Act?
I would want to probably push that back over to Claire to verify but our understanding, Brown County as a government has not received direct payments under the CARES Act. That is correct.
I would just echo what County Executive Streckenbach said.
Claire Mackenzie from WBAY. Can you just clarify the 6-year-old death, the details on gender and zip code for that specific death? 60.
60. It was a male from the zip code 54301.
Claire, our total number of deaths is at 26 in Brown County?
Yes, 26.
Nate Phelps from Spectrum News for Randy. Randy, you kind of walked through these 6 steps. How surmountable or insurmountable is this reopening process for businesses? And Troy, if you want to jump in on that one too, that'd be great at the end.
Is he muted?
Oh, there we go. I was double muted. Can you hear me okay? So that's a great question, and it really depends on the complexity of the employer and what they do. But what I've seen is many innovations of just setting up workstations and setting up policies and being innovative and bringing people back to work, from plexiglass barriers to flexible schedules, and then of course work from home, and then obviously the screening, temperature, masking, and so on. But the employers have been really innovative, I think, in their approach that we've had the opportunity to work with.
So Nathan, from our perspective, First, like just take Brown County government. Obviously, we have 30 different departments. We have many different functions, from public facing operations such as the new zoo, the parks, the airport, solid waste, which, a lot of those operations continue to operate in certain capacities. And then we also have, like in this building where I'm at, Northern Building, we have very public facing departments such as the county clerk, the treasurer's office, the register of deeds, and planning department. And so one of the things that we've requested is for every department before we reopen is to establish their guidelines and verify that they're following the WDC, CDC guidelines for reopening. And that's something that we're in the process of reviewing with public health to make sure that when we open up our doors, that we're doing it in a manner that is both safe for our employees, but also, for our customers and the residents of Brown County, because we want to make sure that we're creating that confidence when they're coming in to do service or business with Brown County. They can do it with a level of confidence. I can say that, when last week, when the Safer at Home order was rescinded, the media and I saw across social media, a lot of businesses actually taking the approach that they were going to, now that they have some certainty about what's happening, that they're going to continue to work with their employees to establish the guidelines that are necessary for them to reopen. And while I think there was a lot of restaurants that could have opened, because obviously we know that there's no restrictions, I was pleased to see that a lot of restaurants, even some bars, take the liberty to not reopen. And they decided that they were going to work with their employees to make sure that they're establishing their appropriate safeguards, not only for their employees, but also for their customers. So from that standpoint, the guidelines that are provided by both WEDC and the CDC make it pretty clear about what individual businesses can do to make sure that they are creating that social distancing that's necessary. And then, of course, the type of procedures to make sure that, when employees are coming in, there's guidance given to them.
Rob Sussman from WTA. What I've noticed is that the hospitalizations are down. This question is for Claire. Are you seeing any sort of like larger trends in any of the recent data?
It's a great question. Not yet. Although on Friday, I don't know if we got these numbers out to you guys. On Friday, Casa Alba tested 623 people and the Resch Center tested 641. So that's well over 1,200 individuals on one day. As we start to see some of these results trickle in, we will, monitor it and see if there are any type of trends. But just with, the amount of testing that's being done across the state, and then there's been lots of changes. The order was overturned by the legislature. Then we issued our own order and that was rescinded. So I think it's still too soon yet to identify any trends that are happening yet, but we'll keep you posted.
Quick follow-up to that. This is Ryan Curry with NBC 26. What is the county prepared to do if there is a spike in cases, given the fact that things are starting to reopen?
So I think right now and I would eventually maybe turn over to David Hemery, who is our corporate counsel, who can talk from a legal perspective. But right now, the way Brown County is going to operate is essentially the tools and authority that it has currently. If they are aware or made aware through through contact tracing or through just advice that's being provided to us from law enforcement, we have the ability to isolate on a case-by-case certain situations. So if we find that a certain employer is known to have somewhat of an outbreak or is a center of an outbreak, we can go in and verify that they're providing for the appropriate guidance and regulations in terms of their operations, and we can monitor from then. Dave, I'll switch it over to you to kind of from that legal perspective.
Thanks, Troy. Yeah, we'll be going back to our more traditional local health functions. That would include receiving complaints or monitoring and observing different data in our community. If we see there is an issue, whether that's with an individual or an entity, then we would target that individual or entity. Typically, we investigate, we assess the situation. Once that's done, we make recommendations and seek compliance. We're not out to penalize people financially or through criminal action. What we do seek is compliance, and we seek that individuals and entities act in a safe manner that does not endanger the public health. If there's an individual that needs to be quarantined, it's within our current powers to quarantine that individual. There's also a court process that's involved with that. If a business or corporate entity or nonprofit, if really any type of corporate entity is acting in a way that endangers the public health, we could also take specific action against that specific entity. One of the issues I had with our order that was countywide was that it was ordering every individual and every business to take certain actions. It's always traditionally been a local health department's duty to investigate, make recommendations, and ultimately order on a case-by-case basis what needs to be done to protect the public health. I'm not saying we don't have additional authority. Certainly, the local health officer has the authority to provide a maximum number of individuals that could gather in public. So there's different various authorities that are still available to us, but where I see this heading going forward is for us to be doing more case-by-case analysis and either ordering specific individuals or specific entities to act in a way that isn't detrimental to the public health.
Hey, this is Jonathan Sadowski from Up North News. I was just kind of following up on that. So with the updated guidance opinion from Attorney General Call, are you still planning to just do a case-by-case basis, or is there any thought that the county might reinstate a stay-home order?
Sure, I can take that one. I really don't see that Attorney General, what's being called an opinion, as updated guidance. I think it is a good summary of what various statutes say, as well as some interpretation from the Supreme Court opinion. But I didn't find that particularly helpful or fruitful one way or another. So I don't see that affecting our actions going forward. I think we're well aware of the points made in that document. We're aware of the authority being cited, and we're certainly aware of the Supreme Court opinion that was issued. Going forward, we'll keep all our options on the table.
This is John Duran from WLUK for the county executive. It seems like there's some frustration coming from the county towards the state since the start of the pandemic. I'll go back to March. You guys had community testing sites ready, but weren't given the supplies. It took an outbreak to get the state's attention up here. Last week, calling for some uniform guidance once Safer at Home was rescinded. And then now we're learning that Brown County didn't get any of the CARES Act money that the state was awarded. Troy, what do you think so far? What's your assessment of how the state has responded to the COVID-19 situation here in Brown County? What kind of a job do you think they've done?
Well, I think it's important to realize the distinction between why Milwaukee County and Dane County received the CARES Act directly is because they are, of course, populations of over 500,000. And so to necessarily say that the state, unfairly provided them resources that they didn't provide to Brown County wouldn't necessarily be an accurate statement. What we do know is that the governor did receive roughly $2.3 billion, and he does have discretion as to how to allocate those monies. And what we're requesting is that the state consider providing those dollars to counties to help cover the expenses that are going to be, for when we request the 75% reimbursement from FEMA, we're asking the state to cover 25% that would hit the local municipalities. As everybody can imagine, Brown County has been impacted this a little bit higher than the rest of the state of Wisconsin in terms of a per capita positive rate and some of the things that we've been establishing, such as the community test sites and so forth and so on. So in the isolation centers. So there have been expenses that have been incurred by Brown County, De Pere Public Health, and Oneida Nation. So we got to keep in mind that when we talk about Brown County, we're not strictly just talking about one entity here. We have the public health response from Brown County, public health response from the city of De Pere, and public health response from Oneida Nation that all are within Brown County's jurisdictional lines. And so when we're advocating for that, we realize we're advocating for, for both city of De Pere and Oneida Nation. And overall, I mean, we saw I don't know if this is necessarily a criticism of the state of Wisconsin in terms of the response. What we do know is that, we had testing. One of the things that we continuously heard from our healthcare providers was to have certain things established and put in place based on what they were seeing, happening on the coast of the state of, the United States, and then what they were seeing in some of the outbreaks that were taking place across the, in Europe and in Asia. And so from that perspective, there were certain things that they were, very confident that the county should have in place. And one of those was community test sites. We also understood that in order for Brown County to get the testing with limited resources, there were priorities being placed as to where that limited resources was being deployed. We were arguing that because Brown County has, the third largest economy in the state of Wisconsin, and that we were the fourth largest from a population standpoint, and that our region, so when we look at the Brown County, you really need to look at it from a regional perspective because of how our counties interact with one another from a workforce and recreational standpoint. And so we were essentially making the case that, we're ready. We would appreciate the resources being deployed up here so that we can get in front of it. When we look at some of the other counties that had received the assets or the resources early on, they were able to get the pandemic or the positive rate, basically under control. If you look at Dane County, they surpassed 10,000 tests a long time ago, and I don't know what the exact date was, but a long time ago, and they're still, I believe, under 600 positive cases to date. So from that perspective, it would have been nice to have the resources deployed up here earlier on. And we certainly were very vocal about it. As I mentioned in previous conversations, we called everybody at the White House that we could, from the State Department to the CDC, in terms of, that early, intervention and being proactive with the testing here in Brown County. And so from that standpoint, we're now in the process of, really asking the state and to look at the CDC and WEDC guidelines and making that kind of like the parameters that businesses should be operating under. So hopefully that'll be the case.
Any other questions for us today?
Claire, it's Nate Phelps. UW Oshkosh had a press release about they contend essentially that there may have been more cases connected to the election than were tracked or counted simply because tracking didn't take into account that the election. Do you have any comment on that? Is that a report you're familiar with, or can you talk just a little bit about your thoughts on that?
Sure. I have not seen that report. I hadn't heard that. In our contact tracing and investigations, we ask very specific questions. I believe did you vote? How did you vote? Or were you like a polling volunteer? And then also in the natural conversation that comes from asking questions, we targeted those who went to an election pretty specifically when it comes to confirmed cases, and we haven't seen, a quote unquote outbreak from the election thus far. Any other questions for us today? All right, thank you. Have a good day, everyone.